Today's guest, Dr. Diana, brought some really cool insights because she has such a unique background in pediatrics, which we don't really get to hear a ton about on this show. And I really like how she was able to give us some insights on how treating children really differs from just the general population and how our gut microbiome develops in kind of those first few years of life. We also talked about things like histamine intolerance and mast cell activation syndrome, which again are really common conditions that we're seeing, but they're really difficult to diagnose. They're difficult to treat. And I really like all the insights that she was able to bring into this topic today.
We went over a lot today, Melissa, and what I took away from this as a really key point was the 3 top tests she orders for complex cases that so many functional medicine providers run into. What really stuck out to me also was she offered clinical pearls in how to use organic acids for best client outcomes. And so, with that said, the gut rules it all in Dr. Diana's words. So, you'll see how that links into all of this. So, let's get started. Hello, and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmy Brown, joined by my marvelous co-host, Melissa Gentile. Today, we're joined by Dr. Diana Stafford. Dr. Diana is a board-certified physician, a member of the International Society for Environmentally Acquired Illness, and a leading figure in the realm of functional medicine, with a focus on mold-related illnesses, GI disorders, and autoimmune disease. With over a decade of experience, Dr. Diana combines her medical expertise with a deep understanding of how our gut microbiome can either work for or against us. While we all recognize that leaky gut is one of the primary root causes of autoimmune disease, we're always seeking experts to help us understand the why and the how, and Dr. Diana is one such expert we're excited to learn from today. Hey, quick question for our listeners. What do Dr. Mark Hyman, Dr. Andy Galpin, and Dr. Rhonda Patrick all have in common? They're all keynote speakers of the Vibrant Longevity Summit. Join us in San Jose, September 27th through the 28th for an unparalleled opportunity to explore the future of health and longevity. Don't miss out on the chance to learn from the best. Register now at www.vibrant-longevity-summit.com. So let's talk the gut connection, dysbiosis, leaky gut, and autoimmunity with Dr. Diana. How are you doing, Dr. Diana? Thank you for being here.
Doing great. Thank you so much for having me.
Yeah, of course. So I'm excited to dive in. And before we start talking about the gut, I would love to know if one moment sticks out in your mind. So as a conventionally trained MD, can you describe one moment that sticks out wherein you realize I kind of want to transition to doing functional medicine and explore that realm?
So, as you guys know, I started out in conventional medicine and practice in primary care for 9 years, both in private practice and affiliated with hospitals. And I guess it's not one moment in particular, but it's a set of related moments where I saw firsthand issues with insurance and the conventional medical system at large, among them being the lack of the root cause mentality, where instead of getting to the root cause of symptoms, we were just quickly putting a band-aid on the symptoms because we had 5 minutes per patient and that's all we could do. And then the symptoms would just come back and the patients would get frustrated and I would get frustrated. And another related issue I saw was just putting one diagnosis or assigning one diagnosis to things. Like even if we said we found the cause for something, we would just put it in a little box with the code that we had to assign to it to get it covered by insurance. And, those things are why I really ultimately decided to leave conventional medicine and have my own practice, which is virtual, focusing on mold illness, the gut, and autoimmunity, because these are some of the most common things and also related to each other, which we're going to delve into. But the most common conditions that are present in millions of people across the world, and they're really not being managed well by the regular medical system with all of the constraints that are in there.
Yeah, very, very true. It's kind of that story we hear all the time, that insurance model can be really limiting. And I think we're still trying to crack the code on how can we offer functional medicine and take insurance. I think that we as a community are still working on that. But I hear you 100%. I've been there.
And
Yeah, absolutely. That's definitely one of my life goals to have it be covered by insurance for sure.
so I know you are a pediatrician by nature initially, but I know you've done a lot of other training and your client base has changed so much over time. So who makes up your client base now? Like what type of populations are you serving now?
Yeah, so I see clients all across the country and the world, really. And a lot of people find me for mold illness, and they'll also find me for gut health. But we really end up delving into at least mold and gut and sometimes autoimmunity as well because they're all related, and to heal from mold we have to heal the gut, again, as we're going to talk about more. But it's kind of those two big categories of people that how people find me is mold and gut symptoms.
So you think it's more of a symptomatic reason for finding you rather than a certain age range or anything. It's kind of more just like people struggling with mold and gut. Yeah. Talk
Yeah, absolutely. I mean, all ages, and then a lot of times I'll end up working with the whole family.
Yes, I think this kind of work applies to so many of us. And you mentioned mold and gut health, Dr. Diana, and there's a big overlap there, but oftentimes I don't know that even practitioners really understand that link or that pathophysiology. And before we start talking about leaky gut in particular, can you just give us a little bit of information on how mold and gut health relate to one another?
Sure, absolutely. So, of course, we're talking about the toxins that mold produces because, the mold that you see and the spores, you can breathe them in and they'll cause respiratory symptoms, but the mycotoxins, which are microscopic, absorb into the bloodstream and are toxic to all organs and organ systems, including the gut,
Mhm.
directly toxic to the gut lining in a few different ways. And we'll talk about that the layers of the gut because it's more than just the tight junctions unzipping. The gut can become leaky or increased permeability, have increased permeability through a lot of different mechanisms and not just the tight junctions. And one of these ways is those toxins irritating the gut lining and making it have increased permeability. And so it's really a direct relation to toxic exposure. And that's one of the first things I talk about with clients when I am going through their symptoms, because so often we'll have gut symptoms and they kind of a lot of times wonder why I focus on that so much.
Right.
But it really is, all encompassing because, the diet and your bowel movements and the drainage pathways and everything is just paramount to actually healing from mold toxicity. So it's that toxin illness that we're talking about.
It's never just one thing. It's always just a cascade of a whole bunch of stuff. It's like
A little
once you
bit of a
dive into
perfect
functional
storm.
medicine and yeah, start pulling everything up.
So those layers you speak of, Dr. Diana, it's not just this tight junctions when we talk about leaky gut. And that's a way of learning about leaky gut that I haven't touched on before. So I would love for you to review that for us.
Yeah, absolutely. And I just love this recent research, and it's still not well popularized. It's from around 2020. And it shows that the gut has 5 layers, and tight junctions are just one component of this. So, the first layer is the atmosphere layer, or the oxygen concentration in the actual tube of the intestines. And it's supposed to be going from room air at the mouth gradually down to zero in the large intestines. But if there's gut dysbiosis or imbalance in the gut microbiome, then that's not always the case. Or if we've taken a lot of antibiotics, for example. And the second layer is called the chemical layer. And there are a lot of different molecules that make that layer up, like secretory IgA, or the most prevalent mucosal antibody, and then defensins, which are antimicrobial peptides. So those are some of the components of layer number 2. The third one is the microbiome layer. So there's actually a layer that is comprised of the microbiome in the gut lining. And it's important to consider the diversity of that layer, which affects, the health of your gut in general, because these good microbes produce things like short chain fatty acids, like butyrate, which help, again, the environment of the gut and prevent things like bloating, gas, and abdominal pain. The fourth layer is that layer where you have the tight junctions. We call it the physical layer, which is the mucus layer, and it's the tight junctions that can become looser. And then the last layer is the immune layer, super important because of things like autoimmunity, and that has mast cells. It's the gut-associated lymphoid tissue. So it has mast cells, dendritic cells, other immune cells there. And I think that just speaks to the fact that the immune system is literally right there. Like our food, comes into contact with the immune system very easily. And it's important to remember that that is one of the layers of the actual gut lining. So those are the 5 layers.
And we'll be sure to link that paper in the show notes. If you would be so kind to send it to us, that would be great because
Yeah, absolutely.
yeah, I think that will be great for our listeners. Awesome.
And Dr. Diana, I did want to kind of just start diving into what is leaky gut syndrome and how does it start? Like, how does that dysbiosis lead to leaky gut, and how does dysbiosis start?
Yeah, so dysbiosis refers to an imbalance in our microbial community in the gut. So we've got bacteria, viruses, fungi, and parasites. And this disrupts the normal functions of the gut microbiome and can lead to all sorts of gut issues and issues in other organ systems. So, as far as causes of gut dysbiosis, a few examples would be use of antibiotics. Broad spectrum antibiotics, of course, kill the pathogenic gut bacteria, but also the good gut bacteria. And medications like proton pump inhibitors, NSAIDs, and others can also cause it. Infections can alter the gut microbiome. Diet, of course, is important. Diets high in processed foods, sugars, saturated fats, low in fiber, or not high in diversity can negatively affect the gut microbiome. And things like chronic stress, lack of sleep are important to remember as well. And as we've mentioned, environmental factors. So toxins like mold can also contribute to the gut dysbiosis. So so this can lead to immune system dysfunction, inflammation, inflammatory conditions, and leaky gut, increased intestinal permeability, and so much more. So with regards to getting from dysbiosis to leaky gut, so just to kind of get from point A to point B there, we've got the dysbiosis, so the imbalance, and then the leaky gut, which is increased intestinal permeability. So dysbiosis leads to chronic inflammation, and then this then irritates and weakens the gut lining, and then we can see that that will lead to increased intestinal permeability. And then with regard to toxins and pathogens, as we talked about, they can directly damage the gut lining, leading to increased intestinal permeability. E. coli also does that. And then dysbiosis can also affect the normal gut motility. So then this leads to an environment in which the gut lining is stressed and overworked. It's being exposed to the food particles for too long of a time or too frequently. And then that can also lead to leaky gut.
And what
It's
are
in-
some of the symptoms that are associated with leaky gut?
Yeah, so great question. Of course, we look for GI symptoms like gas and bloating, diarrhea, constipation, abdominal pain, things like that. But gut symptoms are not always the primary system that's affected. So fatigue is a huge one. Especially chronic fatigue or unexplained fatigue, this can be linked to gut dysbiosis and leaky gut because it's impacting your nutrient absorption and your immune function. Also, things like new food allergies or food intolerances or sensitivities to chemicals or scents or really any sensitivity. And this can affect the gut's ability to process certain foods, as well as skin conditions, because conditions like eczema, acne, even psoriasis can be worsened by gut dysbiosis because of that inflammation piece. And then lastly, I think it's important to also remember mood symptoms because of the gut brain axis via the vagus nerve, leading to mental health and mood disorders and things like that that can also indicate that there may be leaky gut present.
And Dr. Diana, what about, you mentioned food sensitivities? So that's IgG and IgA. We typically think about that. And before we go further, I'd love to know how often are you assessing for food sensitivities? Because I find in practice that it can be quite dynamic. And if we work on digestion, we can build oral tolerance. And so that piece is so important when we're addressing intestinal permeability or leaky gut. And it's one of many things, as you just listed off so nicely. But how often do you assess that? How often do you see that those things change for folks? Especially if it's something like, I was looking at one from years and years ago. I'm sure it's totally different now. I had blueberries and sesame and pineapple, things that I wasn't eating a ton of and that are offering so much nutrition. So, how often do you see those things change?
Yeah, so I see them change so frequently that I do not frequently, order the food sensitivity panel while we're sort of in the thick of getting all the symptoms under control because, a few reasons, sometimes it can just lead us down a certain path where okay, we have to avoid most foods basically.
Mhm.
And, it is useful to kind of see those levels and especially the IgE. We want to know what
Of
foods are going
course.
to be causing those immediate immune responses. And that is very useful. But some of the other antibodies, I feel like while they're useful to know, they often will change, especially when we're dealing with toxic exposures and things like that. And if you're especially currently being exposed to things like mold toxins, then you can continue to develop more and more sensitivities, as time goes on and you're continuing to be exposed. So I will usually wait a few months of treatment and detox and gut work to really figure out, unless we have a reason to get the IgE and things like that, then to really figure out like what we need to assess for with regards to food sensitivities. And because across the board, healing diets are going to be have a few common threads, right? Like we don't want to include processed foods, we don't want to include a lot of sugars,
Mm.
uh toxic foods like grains. So some of those broad strokes are going to be useful and those for a lot of people that takes a while to kind of get that dialed in. So I think going through those broad strokes first can be really useful instead of thinking like, okay, can I tolerate, something like pineapple if it's, is it the pineapple or is it the toxins
Exactly.
or what is the problem, right?
I see so often it's a consequence of and it
Mhm.
being the food sensitivities. So your broad strokes, as you say, makes perfect sense because oftentimes, yes, it's a process to kind of get those foundational pieces down, but it can also alleviate, I think, a lot of the maybe root cause of some of this oral intolerance that we see or sensitivity that we see in folks. So such a
Yeah,
great
and I
point.
mean, in cases where it's really severe, like I've had clients who can only eat 10 or less foods, for
Mhm.
example, starting out, and are sensitive to even exposures to other people. Like they can't even live with their family sometimes
Mm.
because they've developed so many sensitivities. Then we really just have to go very slowly and just work on kind of calming the mast cells, doing the sensitivity work in general. And then, as you said, oftentimes some of those will start to calm down. So,
Mhm.
I do have a question kind of around that. If you do have a patient that comes back, and let's say you do run a food sensitivity kind of early on, I know you mentioned you typically do that kind of later in the treatment, protocol, especially when you're working on all of the gut health things. But what happens when you get a food sensitivity test back? They got 35 food sensitivities. this was me when I first took a food sensitivity test like 10 years ago. And it was like watermelon and coffee and like just even stuff I had never eaten before. And so what happens when you get all these crazy food sensitivities back? And I know you mentioned like some patients like are really restricted at first with only like those 10 foods, but are there sometimes cases where you're like, this is too many foods to cut out? Let's actually just focus on the gut and not so much the food sensitivity piece and kind of let that kind of play out how it
Yeah.
is.
Yeah, so and people do come to me, already having done those panels, right? Because sometimes that's the first one that they'll want to do because it seems like the low-hanging fruit, like, okay, let's just figure out like what food is causing this problem.
Hmm.
And then you'll figure out 35 foods that may be causing the problem. So it's a bit of a slippery slope, but it depends. It really depends on the person because if they are having severe GI symptoms, for example, then yes, a stage 1 GAPS diet, for example, with, only like really well cooked crock pot vegetables and things like that, a healing diet can be really useful if they're like, I just want to do this in the most efficient way possible. And I don't really care if I can eat one food or not eat it. Like, I just want to feel better, which everyone does. But like, if they say, I'm willing to do anything, right, then we can kind of go crazy with it and just do a really restricted diet briefly. Or even something like carnivore, of course, can reduce autoimmune symptoms in some cases, but it's not for everybody. So it really depends on the person and kind of their history too. Where you say things I've never even eaten before, then we talk about, okay, are you actually eating this food? Sometimes it's a food that you're eating frequently, and then also, if you have leaky gut, the foods that you eat frequently, if your body continues to be exposed to them and the gut lining and the immune system there continues to be exposed to them, then it can develop intolerances to them as well. So sometimes just like a little break from some things that, are not reacting well at the moment. So it really depends for sure.
Right, and do you want to backtrack just a little bit and kind of go back to the dysbiosis piece that starts kind of before the leaky gut? How does that piece start? The dysbiosis itself. I know you mentioned earlier antibiotics, like stress can affect the gut. Is it really individual for everybody, or there's some common triggers that can kind of start that cascade of events?
Yeah, I think those are all, sort of common triggers. It's so common to have used antibiotics. Whenever I ask people, have you taken antibiotics frequently or did you as a child? They'd say, common answer would be, for example, not very frequently, usually only about once a year. And then, in my head, I'm like, okay, to me, I would think not very frequently would be like once every 10 years, but it's so accepted, like, oh, in the winter, I'll probably end up having to take a course of antibiotics or some, for whatever. So it's gotten so common and overused. So I think that it just gets a little bit written off, but I think it's important to remember that that is causing dysbiosis for a lot of people because antibiotics not only affect you for those 10 days, but the gut can take 6 to 9 months to recover from one course of antibiotics. So even, just the amoxicillin for 10 days can really start the cascade of dysbiosis, especially if there are other factors present like toxic exposures or taking proton pump inhibitors, because then your stomach acid is down and then you are having things like SIBO and all of the bacteria is going where it's not supposed to be. And then the bad bacteria is continuing to proliferate given the opportunity. So it can really start a cascade of events. And then, I mean, diet, just the standard American diet, just commonly will cause it. So I think that's a common thread too. And then we're all kind of in this sympathetic dominant state sometimes. So the fight or flight state can be a common underlying thread to develop gut dysbiosis because that can impact the gut microbiome's composition as well as its function. So, and then again, mold exposure is super common. It's not you're going to be exposed to mold, but
Mm.
when. So it really, all of these things I think are more common than people really think about.
I do actually, you sparked a question about mold. Why is it that some people, maybe there's two people living in the same place and one person reacts to the mold and one person doesn't? Is that because of their, their gut health, their gut integrity, like their,
Genetics too.
yeah, what does that come down to?
Yeah, and that can be very well, it's frustrating because it can cause people to, people's family members not to believe them and all of these different things when they're having these real symptoms. And there are, again, a lot of factors, some of the most common being genetics. So things like MTHFR and things like the HLA-DR haplotypes. Just 1 in 4 people approximately do not detox mold efficiently and have to actively detox it just based on genetics alone. But then environmental and underlying medical conditions and underlying, like if you already have increased intestinal permeability, then the toxins are just going to, have a heyday and freely flow through the gut lining in maybe you, but not your family member or vice versa. And, kids who are putting things in their mouths and everything like that and are affected differently based on a lot of different factors as well. And it's just, yeah, it's like your genetic predispositions as well as the epigenetics. So it's a whole lot of different factors, but it causes a lot of confusion.
And that begs the question, Dr. Diana, how do you assess for mold illness? And I understand you're probably running this alongside stool testing, but there's no standard workup for mold illness. So even screening tools or clinical assessments, some practitioners, for example, have clinical questionnaires. What are you using from a laboratory standpoint and a clinical assessment standpoint for mold illness?
Yeah, absolutely. So I first have people do my symptom questionnaire, which is I made it 1 page for to be concise, but there are a lot of questions on there about symptoms, and then can kind of get an idea. And we do use that to track sometimes as well progress. And then some people like to use a VCS test or things like that. I love the mycotoxins test. I order Vibrance mycotoxin tests on a regular basis because you guys test for the most toxins. So I definitely love the mycotoxin test. I have done the blood one as well, but if I'm going to do one test, since the urine mycotoxins is a direct measure,
Hmm.
not an indirect measure, I will do that mycotoxins test. And of course, every test has limitations, but it is very useful to see, also that mycophenolic acid to see where there is evidence of actively growing mold putting off its various metabolites. So, and I like to repeat that test depending on symptoms and course around every 6 months.
What about any of the Sears markers? Like serum MMP9. Are you running any of those? And you mentioned the genetic marker as well.
Yeah, so I don't regularly. I will do it on request or if we discuss it and we kind of are just doing everything. But, I find that it's, it already gets, all of this gets expensive, of course. And
Mm.
so that's always a consideration. But for sure, if I'm going to do everything, more information is always better. I like the SIRS labs, but I don't focus on them because it's like we kind of know some things are going to be abnormal. If we're having, I go on symptoms and whether I, from the MD perspective, think, okay, well, this person needs to, see a specialist for this thing because we also need to rule out other things
Mm.
or other effects that the mold has had. Or, we kind of try to focus and not get bogged down in like, okay, what is your level of your ESR, CRP, or MMP9, or things like that, or complement markers. And, they can be useful to track progress, but I love just using the mycotoxins test to track progress as well as uh, in the gut zoomer. Definitely looking at those fungal markers as well, because that's another way of looking at it. And also the oat test. I get a lot of oat tests for those are kind of my top 3 tests that I'll get if people are willing and able to do more than just the mycotoxins test, then we'll do those other two as well, because we can see it from all angles as far as the fungal markers and the gut dysbiosis and the autoimmunity markers and everything in there, so that we can really like have a good plan of action.
Do you ever start with oat alone? Because I know a lot of practitioners will start there if it's a complex case and they don't really know what to order next. Maybe someone's denying GI symptoms, right? And they say, I don't have any mold in my home. No, I'm not, it's not even a concern, even though, as you said, it's not if, it's when. So I'm curious, do you ever just start with oat, or are you always blending it alongside right up front?
Yeah, I have done it before. Yeah, definitely. Currently, like I say, most people are finding me for gut symptoms or for mold. So generally they will have one of those things. But if they don't, or sometimes they'll come to me with an oat test,
Okay.
because their provider has ordered it, and then they're like, oh, there's a lot of stuff on here. You probably, should look for someone to help you with that kind of thing. And then we will go off of that. I definitely love the oat test, and I get it regularly. But yeah, a lot of times either people will come to me with it, or they will have the symptoms that will make me want to order the other two as well.
hmm And then I feel like I'd be remiss if I didn't mention oat is something I think a lot of practitioners are a little wary of. It's very, very comprehensive. So, what are kind of some key points that you're pulling out from that test? There are some indications that there might be fungal overgrowth, right, or bacterial overgrowth somewhere. Kind of what are the big takeaways that you generally see, or patterns that you see when you run oat?
Yeah, yeah. So for the organic acids test, I look at, like you said, the fungal markers to see is there evidence of certain fungus or candida. There's certain patterns on there that can indicate candida. Also, it's really useful to me to see the metabolism, because I love supplementing with amino acids and things like that.
Mm.
Because, things like I had a client just yesterday who multiple different markers on there showed that they needed acetyl L-carnitine, because they had all of these different abnormal levels on the organic acid test. So I think that supplementing with amino acids and looking at those different levels on the Krebs cycle and things like that are underappreciated. And we would miss them if we didn't do oat tests, because we don't see that on those other tests.
Mhm.
So, what kind of amino acids may be affecting your mood, maybe affecting your gut, digestion, and all other organ systems are important to kind of see. And I think that test is the best way to get an idea of those that I use.
Yeah, makes sense. And it's not just showing you, okay, what cofactors may they need nutritionally speaking, but how is it impacting, as you said? So it can be really incentivizing for patients. Like you said, is it mood, and no one else has looked in that way at their metabolism of these things. So great point there. And speaking of organic acids, this is a test that a lot of practitioners will turn to for kiddos and pediatrics overall, because it's urine, it's easy, it's accessible. So with a background in pediatrics, can you give us some insight into how do you approach those clients? How are you assessing them differently? How are you managing them differently than an adult case in terms of leaky gut?
Yeah, yeah. So, and I think oat tests, yeah, definitely use them a lot in pediatrics. And it's interesting because in the conventional medicine world, we did do oat tests. Like those can be covered by insurance. So we did do them, but we were coming at them through the lens of, okay, if this is abnormal, then you need to see genetics, because
Mm,
there may be like an inborn error of metabolism. And that's true. But a lot of times it is toxic exposures, or it is overuse of antibiotics, causing a lot of gut dysbiosis, or other things that are not inborn errors of metabolism. And it's important. And I have sent people to genetics from O tests, but we have to broaden our differential diagnosis beyond what is recognized currently. So as far as differences in approaches, definitely it's gonna be the formulations of things and certain things that I don't use in kids. We use a lot of, liquids. I use topicals. I use tinctures, all sorts of, essential oils, even like all sorts of different modalities or formulations to help to heal the gut. And diet, again, is going to be one of the first things that we try to address, because just getting parents to just get behind the fact that their kids are not the boss when it comes to their dietary intake. And we can formulate and shape their microbiomes in the first 4 years of life, especially. But even if it's later, we can really shape those based on diet, like giving them usually advice to do grains only once per week at home, and trying to pack their lunches and do low toxin diet is useful for everyone, really, but especially for kids whose gut microbiomes are still developing, and they're still, not only that, but getting those habits, because as we know, when we're craving things, it's not ourselves craving things, it's actually our microbiome craving things. It is the bacteria, it's the mold, it's the fungus, it's the candida, it's the parasites craving those foods. So if we can kind of get behind that and make sure that we are eating the healthy foods, then we will be able to make sure that the good bacteria are thriving.
And real quick, Dr. Diana, you mentioned tinctures. So for little ones, of course, tinctures are generally alcohol extracts. Do you have any glycerite favorites, or kind of what's your take on that whole conversation?
It's great if we can avoid any alcohol content whatsoever, but there are, sometimes it's not avoidable, and it's a small quantity, so I don't stress too much about it, honestly. But, I do try to avoid it, and um, it's not my primary consideration, but I do try to avoid it. I use a lot of herb farm products, use a lot of BioRay products. So yeah, we try to get around it if possible.
Yeah, exactly. That's kind of how it's like, if you can, otherwise it's such a tiny, tiny amount. But some parents are concerned. So
Yeah,
just throwing
important
it out there.
question. Yeah, common question, yeah.
Yeah.
I did have actually one quick question too. I know you mentioned so grains is a big thing, especially with mold. What other things do you typically recommend us cutting out of our diet?
Yeah, so yeah, grains across the board are pro-inflammatory, and corn as well is a common one that people think, oh, it's a grain. People don't really associate it with being a grain. They think, oh, I'm doing gluten-free, so I've substituted everything with corn.
Mhm.
And it's actually not a healthy substitute. It predisposes us to even things like autoimmunity and even things like cancer, and it's not well digested by humans. So corn is a really big one that a lot of my clients come in eating, because they've tried to substitute out with the gluten, but I'm like, okay, it's all grains, including
Mm.
things like rice, which is unfortunate because there's no texture that's the same as that. However, there are substitute rices that are made from legumes, which is, they're a cousin to grains, but some people tolerate them, some people don't. And then things like potatoes are a great substitute. And, thank God for potatoes, I feel like. And then
That's
also sugars, of course, are never going to be good. Of course, fruit, we think about, okay, does fructose count? To an extent, but things like, berries, definitely, as we were mentioning earlier, super healthy. Like, I'm not gonna tell people to avoid berries because they are, low glycemic index, and they have so many wonderful antioxidants, things like that, and other benefits. But, excessive amounts of fruit, or like fruit juices and things like that, definitely advise to limit, as well as, of course, the added sugars, and substitutes for that would be like stevia and monk fruit. And then processed foods. So processed foods across the board are going to be higher in toxins and just lower in nutritional content. It's basically devoid of nutritional content in many cases. So those are kind of the big categories, but then of course there's a lot of other
sure.
dietary considerations, like organic versus non-organic. It's important to try to do organic when possible, grass fed, everything like that, pasture raised eggs, definitely makes a huge difference for nutritional content, as well as tolerance, because I do have clients who have not been able to eat like regular eggs or like cage free eggs, but then they can eat the pasture raised eggs. So it's trying, kind of teasing out like those little details that can really make all the difference. And lots of hydration, water, clean water, filtering that water, making sure that we're not putting more toxins in our body from beverages as well.
What about lectins, Dr. Diana, which we see in a lot of healthy items, again, produce items, so not just grains. Are you ever concerned about those?
Yeah, yeah. So can definitely go that route if people are still having gut symptoms, and maybe we've tried some things, then I will decreasing lectins. Um, but yeah, I mean, it depends on the person. Not always the primary thing that I'm looking at, but I have researched that a bit, and it's worth considering.
Yeah, especially and we talk about the anti-nutrient impact that,
Mhm.
sometimes lectins can have, but there's ways to mitigate or lower lectins, right? So if we're
Yeah.
soaking, again, if you're not really gonna go if you're not advising people to do any grains, but, if it's in the skin of the tomato, for example, or the seeds of the
Mhm.
tomato, are you thinking about those things to kinda get around it?
Yeah, yeah, definitely. Sometimes, peeling things for sure. I have done that with people, and it makes a lot of difference.
Yeah.
And Dr. Diana, we haven't had a huge chance to get into mast cell activation a ton on this podcast. I know that's something you're pretty well versed in, and I've seen you post a bit about it. So I do want to talk about what's, kind of the link between dysbiosis or leaky gut and mast cell activation, or even just starting with, what is mast cell activation? It's kind of a newer concept. I know it's really challenging to diagnose, so I just want to dive into that.
Yeah, sure. So basically, mast cell activation syndrome, or MCAS, is where your mast cells, which are part of that gall or gut associated lymphoid tissue in the gut lining, layer 5, the closest to your bloodstream, these get overactive and they release off up to 200 or more different molecules or mediators, which include histamine, but a lot of different things as well, in response to a variety of triggers. So it's more, to me, MCAS is not going to be your root cause. Like, it's going to be a symptom or it's a syndrome, but it is indicative that there is something that's irritating the mast cells. So it's thought to be due to genetic predisposition, as in a lot of cases, and environmental factors. Triggers like mold exposure, super common. Triggers like Bartonella or Lyme co-infections, other infections, medications can also trigger it. And then symptoms of that are broad ranging. We see a lot of skin rashes, hives, itchy skin, and then sensitivities, right? So being sensitive to things that you didn't used to be sensitive to, your food choices are decreasing, sensitivities to perfume, things like that. And those can cause symptoms all over the body. I mean, you can even see anaphylaxis reactions with this. And then gut issues, again, primary gut symptoms can happen with mast cell activation, even nervous system issues like brain fog, and even circulation issues like dizziness or palpitations or flushing. But there's always a trigger. Like, if people come to me and they're like, okay, X, Y, and Z triggers symptoms, then I'm thinking, okay, we have a mast cell issue. We need to stabilize the mast cells. I don't do a lot of tryptase testing or things like that because you have to hit it at the right time during a flare and compare it to when it's not during a flare. And, it's useful again, but I like to kind of focus on the tests that we talked about because they'll give us more information. And I think some of those other tests can lead to more confusion. But MCAS can be very unpredictable and can definitely affect life, quality of life for sure. So it's just about getting to the cause of it and figuring out ways to stabilize the mast cells, doing some natural antihistamines. I use a lot of like quercetin, vitamin C, omega 3s, things like that, which are also useful in general for all the other things that I'm treating. And then uh, things like digestive enzymes and other ways to kind of make sure that when those food particles and toxins reach the mast cells, they are not going to irritate them as much.
Any patterns you see on stool testing, oat, and mycotoxins or total toxins for MCAS?
That's a good question. I don't know if I can actually pinpoint any patterns that I've seen, but I will have to look out for that for sure.
Yeah, I'd be curious because it is kind of that mysterious, hard to assess and treat condition. And you mentioned it's generally secondary to so many of these things. Um, but kind of the bigger overarching question here, when it comes to stool testing, what are you looking at on those results that may indicate autoimmunity or risk for autoimmunity?
Yeah, so I look at, of course, the whole picture, but a few things on, for example, the gut tumor that I like to look at is zonulin, of course, the protein that regulates the tight junctions. So high levels can indicate leaky gut or autoimmunity. And then we talked a little bit about secretory IgA.
Mhm.
So I like to look at that level, as sometimes if that's off balance, that can definitely indicate either the immune system is down or the immune system is overactive,
Mhm.
depending on the level. And then we have the calprotectin, which is used even in conventional medicine. I would use that for inflammation in the gut. So following that level is really useful. And of course, the antigliadin antibodies are going to be useful. Even though across the board, I'm going to recommend to limit gluten, it's useful to see just how much or what effect it's had
Mhm.
on and how many antibodies are actually present. And then a lot of other markers in there. I mean, really, like almost every thing on a gut tumor will speak to dysbiosis and levels, because if it's not in the box of the levels of commensal bacteria, for example, then you have some degree of dysbiosis.
Mhm. Yeah, and I find looking at those results holistically, I mean, they all link into one another is what I'm hearing you say, and I agree with that. What about fecal calprotectin? I'm just curious, if it's really high, if it's like 300 or 400 and you send to gastro, for example, or you repeat it and it's persistently elevated, or maybe it's not so high, and they don't have IBD, inflammatory bowel disease. They don't have an infection. They don't have diverticulitis. Do you see any cases wherein the calprotectin will go up and it is toxins or it is a food sensitivity?
Yeah, so I mean, I don't know if I can directly say that I've seen that and I can directly correlate it, because there's always a question of like, is someone being exposed to mold right now or not, or what is going on? And there's a lot of different variables, but I mean, for sure, I've seen super high levels of calprotectin when there's just primarily mold exposure causing all of the symptoms, and we don't have a whole lot of other stuff going on. So I mean, I think that link probably has to be further explored.
Absolutely. Yeah, it's just something I'm always curious about because especially in people who've had all the workup, the big stuff's been ruled out, and you just have to
Yeah.
wonder, and you do all those foundational things and come at it from all those different angles, I'm
Mhm.
sure you see that come down, so great
Yeah.
point there, yeah. What about a case study? Is there a case study that comes to mind when it comes to leaky gut, which can apply to MCAS and mold and etcetera? Is there a favorite?
Yeah. So I guess I'll just talk about in general, kind of my experience in general. So, like I said, I got into this focusing on mold, but a lot of those clients weren't getting better just by dealing with mycotoxins or doing binders and antifungals and
Mhm.
organ support antioxidants. So I started doing a lot of research on autoimmunity, because it seemed like that was the missing piece. And there's also still a lot of gaps in the current literature. So I am putting my own framework together into different pillars of autoimmunity, some of which are going to be the gut dysfunction and the genetic predisposition and the toxin exposures. And these are components that really are everywhere across chronic illness. And so I've been using this as a lens recently, as a lens through which to work up my clients and their symptoms. And I did do my MCAS playlist or series recently on social media because I've had a lot of people just really coming with these MCAS type symptoms and these sensitivities. And I think people are just hungry for knowledge and help with that. Really, right now, it's a big issue. And so I'm working with a lot of people on that. And also another really common thing that I'm seeing recently is constipation. That's
Mm.
People think of inflammation causing diarrhea, but it can also cause constipation because of effects on motility with toxins. Can cause constipation, diarrhea, both. But I've seen a lot of constipation recently, and so I've been using a lot of, herbal laxatives, supplements for constipation, opening the drainage pathways, bile movers, things like that, and even non-traditional methods like fasting.
Mm.
And then I'm seeing that just keeping in mind these different components of autoimmunity are helping my clients more recently, get better as well as stay better, because we don't want them to be just in remission.
Yeah.
We want them to be well, like not have any more disease state. So those have been kind of some of the common themes that I'm seeing recently and how my clients have been improving.
And what does a typical treatment protocol for leaky gut look like? Do you have certain phases that you like to kind of walk through?
Yeah, so we talked about diet for as well first. So that is a big thing that I start with, addressing the diet, right? We have to address diet first and foremost. And also physical activity, exercise if possible. And sometimes we have to do nervous system work first as well if they're really in fight or flight and it's not going to be possible for them to heal if they're still in that. So it depends on the person, but sometimes those are things that we have to address first. But as far as supplementation and protocols, definitely I'll use a lot of butyrate. We talked about that earlier. As a short chain fatty acid, it is a supplement that is still under recognized as important, but it is, up and coming and super, super helpful for a lot of my clients. I'll use a lot of digestive enzymes and mast cell stabilizers. Probiotics are kind of the issue and the great thing and the difficult thing at the same time, because sometimes they will help, sometimes they will cause more inflammation. So it depends on what they need at the current time. Sometimes we will not do probiotics first. Sometimes we'll come back to them after the inflammation is down, or sometimes we'll use something very gentle like a Saccharomyces boulardii or things like that. And sometimes, again, with the sensitive clients, I'm using like little drops or little bits of powder to help the immune system to get used to things first, because sometimes we're at that point where it's just not going to be possible to just start with a whole capsule kind of thing. So, and then making sure that we're avoiding toxins not only in the diet but in the environment.
Yep. So comprehensive. It's top to bottom. So much to think about. So when you're putting these plans together, Dr. Diana, and before we wrap up, I have to know, as a conventionally trained physician yourself, how do you communicate with other conventionally trained practitioners if, for say, you need to coordinate care? And do you have an elevator speech, for example, to explain the complex relationships between leaky gut and autoimmunity, et cetera, everything we've talked about today? Kind of what should other functional providers know in terms of talking to allopaths with all of this information?
Yeah. Yeah, so I like to think that they will listen to me because I have an MD also, but sometimes it's not the case. So I I just kind of, when I'm talking to, or advice I give other practitioners, is just to keep in mind that the gut rules it all. Like in every chronic illness, the gut must be addressed, and just to kind of put that in their minds and say, okay, if you are trying to help someone with a chronic illness, for example, are they getting better? And have you addressed the gut? And if not, then are they getting well, staying well? If the gut isn't happy, it's not going to be possible usually. So I think that it's definitely still underappreciated, under-recognized that the gut rules it all. So that's kind of the first thing that I will say to people. And then, I mean, definitely mold illness is something that people are still not really getting behind as far as the conventional medical world, but that, it's just behind, but we'll get there. So definitely still trying to increase awareness about that for sure. But it's just the gut rules it all. And if your clients are not getting better, then that's going to be the first place that I would look. And I think, we all have that, that's what we're all trying to do, right? Is to help people get better. So, it's just a different way of looking at it. And it's not taught in med school like that. So it's just changing that mindset takes a little time sometimes.
Totally. There's so much to unpack there. And I love how you said, we're not pointing fingers. It's really just we're getting there and we need to educate one another and using the fact that it's not about our biases as practitioners, it's about the patient. We want the patient to get better. And if the gut has not been addressed, and that's so clever that you can really just use that as well. Have you addressed this? And they're not getting better. Well, it's kind of like the ball's in their court at that point to say, well, maybe you should consider the gut. And the gut rules it all. That's really going to stick in my mind. I love how you put that.
And I kind of feel like the mold illness piece is just starting to get a little bit more attention. So hopefully that just continues to kind of improve over time. But you're so right. I feel like with no matter what condition you're trying to treat or like what's going on, it's like, it's almost like you just always go back to gut health, and just starting there is really going to do you well. So I really appreciate all the insights and just everything that we kind of dived into today, especially mast cell activation syndrome, and your expertise, like working in pediatrics, is really unique. So I'm so happy you were able to share so much knowledge with us today, Dr. Diana. I really appreciate it.
Thanks for having me. Absolutely.
And I'd like to end each episode on a really positive note. So we always like to ask our providers on the podcast, what does it mean to you to live a vibrant life?
Oh, so that's a great, great question. And I think for me, it just means to be my best every day and to help others to be able to live their most healthy and best life, and to always take that next best action step, because there's always a next best step, and there's always some kind of action that we can take. And so that's why I call my protocols my action plans, because there's always something that we can do, even if we feel like it's a small step. It's always something important, and there's always that next step.
I love how you call it an action plan. I feel like that has like a good momentum, good motivation in it. And we know you're really active on social. So where can our listeners find you?
Absolutely. Yeah. So you can find me as the Detox Doc on social media. And my website is drstafford.com. And then, as I mentioned too, I'm working on formalizing my pillars of autoimmunity into a course and accompanying book and other materials and content coming out later this year.
Awesome. And to our listeners, we'll make sure that we link this down in the show notes that you guys can find Dr. Diana online and all of her resources. And thank you so much, Dr. Diana, again, for coming on the podcast today. And thanks to our listeners for tuning in. And until next week, stay vibrant.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.